While the harm reduction is theoretically here to help prevent overdoses, save lives, and reduce the spread of disease, I can't help but wonder if in Vancouver's attempt to copy the Portuguese model of handling drug addiction, that they've forgotten that harm reduction is a means to an end. One of many tools used in an incentive-based approach to help encourage drug addicts to reintegrate into society, get a job, treating their addiction as a health crisis rather than criminal activity. If only there was a highly qualified doctor who has studied this issue for the last 20 years that might have a practical solution to treating Canada's drug epidemic. I want you to tell me about the research you were conducting, how it eventually was ordered to be destroyed, and what you found throughout that research.
That first mentor that I mentioned, Bruce Alexander, people who know addiction will likely link his name with some studies that were known as the Rat Park experiments.
Okay.
What Bruce showed in that work, and it had a big influence on me, was that rats living in isolation, given a choice between morphine and chow, tended to consume quite a bit of morphine. But if you took those same rats, even after they became dependent on morphine in isolation, and you moved them into a park-like setting where they're living with other rats and they've got lots of stuff to do, they will switch their preference and instead orient to chow. It's like a natural intervention. Part of what inspired this was when Vietnam veterans had been identified in the 70s as addicted to heroin.